Hi, I'm Don Anderson. It's my pleasure to present to you the strategic plan for the new Department of Mental Health and Addiction Services. Back in April of this year, Tracy Plouck asked me to work with the staff of both departments to develop a plan that would set a course for the new department now and into the future. Nicole Marks joined me in that effort, and this strategic plan is the result. In order to get input from staff for the department, we held a series of 4 forums. In the first forum, we asked the participants to identify what they felt would be the strengths and weaknesses of the new department. We also asked them to identify what opportunities the new department would be able to take advantage of going forward and what threats it would have to deal with. In the second forum, we asked the participants to identify the critical issues the new department would have to deal with. The third forum was focused on developing strategies for dealing with certain key internal issues. And finally, in the fourth forum, we asked the participants to recommend goals for accomplishing the important internal strategies. More than 140 staff from the 2 departments participated in the forums. They came from the 2 central offices and from each of the 6 hospitals. The senior staff of the new department developed its mission, vision, and values and helped focus the efforts of the 4 staff forums. It also developed the proposed strategies and goals for dealing with the new department's customers. We view the planning process as ongoing. First, senior staff will be seeking input from key stakeholders concerning the proposed strategies and goals that affect them. That input is considered critical, and it's why the plan is labeled as draft. Second, the strategies and goals will serve as guidance and direction to the offices and bureaus of the new department as they create or modify their own plans. The mission of the Ohio Department of Mental Health and Addiction Services, as developed by senior staff, is to provide statewide leadership of a high-quality mental health and addiction prevention, treatment, and recovery system that is effective and valued by all Ohioans. Its vision is the Ohio Department of Mental Health and Addiction Services will be a national leader in implementing a comprehensive, accessible, and quality-focused system of addiction and mental health care and wellness for all Ohioans. The underlying principles or values the new department will use to govern its behavior are access, accountability, collaboration, communication, and service. The first 7 strategies are focused on the department's customers. The plan contains goals to carry out each of those strategies. The first customer strategy is to provide access and improve overall clinical quality and consistency through the system of care. The second customer strategy is to increase access to permanent housing by creating new and strengthening established partnerships, expanding community funding opportunities, and increasing the quality of housing options for persons with addiction and mental illness. The third customer strategy is to support the integration and coordination of physical and behavioral health services through funding, research, and policy in an effort to reduce disability and the early loss of life for those with addiction and mental illness. The fourth customer strategy is to reduce unnecessary regulations and administrative barriers to promote access to treatment while maintaining safety standards. The fifth customer strategy is to promote the health and safety of individuals and communities by modernizing and integrating Ohio's behavioral health prevention and intervention system. The sixth customer strategy is to enhance the availability and quality of services to meet the needs of individuals with addiction and mental illness across the lifespan. The seventh customer strategy is to provide necessary support for the statewide opiate initiative to be successful. Last four strategies are focused internally on the staff of the new department and are based on input from the 4 staff forums. The first internal strategy is to develop a systematic, structured approach to getting department employee feedback. In order to accomplish this, we will be creating an online system of employee feedback by October 1st, 2013, that includes the option to comment anonymously or leave the employee's contact information. We will also be developing an employee satisfaction survey via SurveyMonkey by September 1, 2013, with analysis to be completed by November 1, 2013. The second internal strategy is to develop a systematic way of communication as to what and why decisions are made throughout the department. In order to accomplish this, senior staff will establish space on eZone by August 15, 2013, to publish summaries of regular meetings and a mechanism for employees to provide feedback. In addition, department staff will be identified to form a group that reviews and responds to submissions from the online employee feedback forum by August 15, 2013. The third internal strategy is to identify the differences and similarities between the former department's respective cultures with an eye toward blending the two. Senior staff will create a department group that will meet monthly through April 30th, 2014 to discuss ways to create an organizational culture that supports and enhances the new department. And human resource staff will develop a comprehensive orientation format for department employees that incorporates concepts from the former department's specialties by August 15th, 2013. The final internal strategy is to develop a practical approach for training in the new department. The department will conduct an annual department employee development needs analysis starting August 15th, 2013, to be completed by September 1st, 2013. It will also develop a web-based department training resource guide to be completed after the needs analysis is completed, with a deadline of November 1, 2013. You can access this presentation and the full strategic plan by visiting our website. Thanks again to all who have participated in this process. I want to again give special thanks to Nicole Marks, whose support was invaluable. You can send any comments to me through her email, which is shown here and on the website. I believe this new department faces a bright future. Hopefully this strategic plan will help make that a reality.